vaccinated. Close to 3.5 million vaccines administered in total. 31% fully vaccinated, as we know. The vaccines are working. The outlook is very positive. But what about the 30 to 39 cohort? I know the portal opens on Sunday, but I understand that the pace will be somewhat slower for this group, the pace of rollout, that is.
Good morning, Joe. Pleasure to talk to you again. First of all, you're absolutely correct. We are in a much stronger position in terms of the impact of the virus, and that is specifically and primarily related to two key things, really. First of all is the benefits that we're seeing from the vaccination programme to date, and you've relayed the figures there, so I won't repeat them. But also secondly to the fantastic support of the public for what has been a horrendous 15, 16 months in supporting the public health measures and sacrifices that many people have made in society and indeed have made in business and enterprise as well. Specifically to your question, no, we will be continuing at really strong pace. We have a few priorities now over the next few weeks with the vaccination programme. Firstly is to administer the dose 2 vaccines to the people who have received the AstraZeneca and their dose 1, and that'll take place over the next 5 weeks. And in parallel with that, we will be continuing on with the rollout, as you've mentioned. Firstly now, the 35s to 39s portal opening on Sunday, online registration. And no, it's not that it'll be slower. There's two key factors here. First of all, we have a very significant increased population size in this age group. So the 30 to 39 age groups, about 710,000 population. So it's a much bigger population than we would have had with the other age groups as we walk through them. And secondly, our supply lines are, particularly now as we move into July, our two primary supply lines now are back to Moderna and Pfizer. So the AstraZeneca supply line, or indeed the Janssen supply line, are not the vaccines that are medically approved for this age cohort. So we have to use the vaccine supply line that we have. So we have 3 good weeks ahead of us this week and the next 2 weeks in terms of supply lines. And then it reverts back to the forecasted supply lines that we have from Pfizer and Moderna primarily.
Now, you've been tweeting a daily update on the numbers in hospital, including ICU numbers. Where are we at today?
Yeah, and that comes back to what you said in your own introduction, the benefits that we see from the vaccination programme. So right now, today, there are 52 inpatients across the country in our hospitals who are COVID positive patients, and 18 in ICU. And 24 hospitals now have 2 or less cases. In fact, 10 of them have no COVID positive cases. And that is a function of the vaccination programme, because if you watch the daily cases now on any level at any given day at the moment, 83% of the cases are now below the age of 45. So what you're seeing are the vaccinated population that we've got to date being strongly protected against the impacts of the virus. So, less hospitalizations, less illness, less sickness, less ICU, and less mortality. So I guess one of my key messages to your listeners this morning is the vaccines are working, and really important that as we call people forward now to come forward for your second vaccine, because you're at your highest levels of protection when you received your second vaccine dose, and particularly for the AstraZeneca program that we're on at the moment, you have a 92% protection against hospitalisation against the Delta virus by getting your second vaccine dose. So key that as we call people, everybody comes through. But hospitals in a much stronger position related to COVID. I can talk separately about some of the impacts we are seeing in relation to cyber attack and just generally demands on the services now.
Okay, well, and I will get to that in a moment, but you probably heard in my introduction earlier today, and this has been quite consistent all week, people have been requesting information on the number of COVID deaths. Now, we know because of the ransomware attack, it's difficult for you to collate accurate information, but what can you tell us in relation to the number of COVID deaths that have occurred over the last 30 days or so?
Yeah, and you're right. Since the 14th of May, 36 days now, I'm counting nearly every day because of the impacts. But yes, we don't have a direct link to where we would have got some of the coroner reported deaths coming through related to COVID. But what I can say is significantly less deaths. It's probably in the region, the indications we have, it's about 38 deaths since that time frame. So, much lower mortality levels that we are seeing related to the virus overall. We'll have confirmed figures shortly, but it's in that region.
All right. So what you can say is, and correct me if I'm wrong, listening to you at your press conference yesterday, we're about today, 36 days on from the ransomware attack. You're saying the number of deaths are in the mid to high 30s throughout that entire period.
That's correct, Joe, yeah. So, we are seeing, if you trend that against any levels of mortality, nobody wants to go back and even reflect back in the dark days of January where we were seeing, the significant hospitalizations, ICU mortality, It's really interesting if you compare, January, in some ways it seems a long time ago, but it's not really. And if you compare even the hospitalisation figures that I just quoted today, in January we had 2,020 people in hospital. We had 212 people in ICU. It was very hard to see the light at that stage, and significant mortality as well. So we are in a stronger position. And again, I suppose my second call to the public is, I guess we need to sustain what I was always called three legs to the three-legged stool, which will, one, are the vaccination programme, and we'll continue that at pace. The second is our testing and tracing programme. We need to be continuously diligent and call to the public. If you do feel you have symptoms, please come forward. We have many of our centres now that are walk in or seek a referral from your GP, or seek a consultation with your CP because it may not be COVID. But also the third piece is the public health support, and really all of us keeping our guard for a continuous period, because I know it's been a horrendous period for everybody, but the more we keep our guard, the more we protect the progress that we've made.
Now, the Delta variant, Paul, as we know, it has had an impact on the further reopening plans across the water in Britain. It's now having an impact on plans to reopen north of the border. I think it was confirmed at the press conference yesterday. It is here in Ireland, about 188 sequenced cases, mainly along the eastern seaboard. But the numbers, it seems, are not rising rapidly here in this country. Now, think about that, because I'm going to ask you to answer it in a short moment, but...
The Joe Finnegan Show on Shannonside Northern Sound.
And we're joined in studio by the Chief Executive of the H.S.E, Paul Reid. I was asking you there, Paul, about the Delta variant. It is here in Ireland, I think confirmed yesterday at the press conference, about 188, I think the word you used is sequenced cases, more prevalent along the eastern seaboard, but it's not rising rapidly. But it is fair to say it's still a cause for concern.
Yeah, Joe, and I think the one experience I've had, and I think we've all had throughout COVID, has been at any stage when you think you're well ahead of the virus, it has a tendency to catch out. That happened to us all, not just at Christmas, but back after summer last year as well. And I guess the one big threat we do have is particularly now the Delta variant, as you've described it. The experience in the UK has demonstrated it's up to 60% more transmissible even than the variant that we've been dealing with. So it's a very significant threat that we have to guard against. A lot of indications of increased hospitalisations across the UK. From our perspective, you're right, we have 188 cases. They have risen, not significantly. It is a threat to us in terms of its potential impact. Again, what I would say is, a second dose of vaccines do give a stronger protection. The Pfizer and Moderna one would give a 96% protection, and the AstraZeneca give a 92% protection against hospitalisation against that Delta variant. One of the reasons we have what we call is an enhanced tracing process in place. So if we detect a variant, as you just described there, a case, we do increased contact tracing. So, in some cases where we might not deem a person as being a close contact, if it's a case of a variant, we would deem a lot more people close contacts and work through testing for those or isolation for those as well, restrictions. So, but it is one we would have to monitor very carefully.
And I know, Paul, from calls we've been getting into the show, let's focus on the over 60s cohort if we can. Many of them would have received the AstraZeneca jab. You've confirmed there that a second jab will give them at least 92% protection, but they're still waiting. Many of them are still waiting. What reassurance can you give them this morning in relation to them getting that second jab?
Yeah, I will give them a very firm reassurance. First of all, if you remember the recommendations, which we take our recommendations from the H.S.E, we don't just decide these factors ourselves. The recommendations from the National Immunisation Advisory Committee originally moved the period from 12 weeks out to 16 weeks. And then it moved back to 12 weeks. And now the recommendation is to move it to 8 weeks. So we're in the process now. There's about 450,000 people who have to receive their second dose AstraZeneca. That was originally to be done over a 9-week period from now, which would have brought it up to the middle of August. What we are now doing is accelerating that further. We're going to vaccinate those 450,000 people between now and the 19th of July, the week commencing the 19th of July, and that week. So this week alone, somewhere between 90 and 100,000 doses of AstraZeneca second doses will be administered across the country, and roughly about another 100,000 per week in the next few weeks. So what I will say to people is, and I'm already seeing it myself on social media and other feedback, is significant numbers, and we will start with the older population, so the 60 to 69s, and bring them forward. So people will get their call, and no need to contact us. We will make contact with you through your text, and please do come forward for your appointment as we set it out for you.
Now, the rollout, as we said, it's moving apace. Nearly 3.5 million vaccines administered in total, 31% fully vaccinated. But are you in the H.S.E and others actively planning for a booster campaign at the back end of this year?
Yeah, it's a really good point, Joe. So the evidence and the science is still not clear across the world about what will be required. I think it's two assumptions we probably can make. One is that, there probably will need to be a vaccination program into the future. And we need to think about how we plan for that and how we do it. Whether that's boosters or whether it's an annual renewal of the vaccine is still not fully medically determined just yet. But the likely evidence will be there will be a need for a booster or an annual renewal. So we have to plan now and think about how we would do that, how we administer it. Obviously, our model right now, our vaccination centres primarily, and GPs who played a huge role in all of this, and now pharmacies coming on board. So we have to look at that for the future. What would the model for that be? But right now, our concentration is, as you said, getting the rest of the remaining of the third population with their first dose, and then getting that 31% up to, and they are percentages of adult population who qualify.
But you're not ruling out a booster campaign, if I can call it that, kicking in before the end of the year?
That hasn't been determined. I can't rule it out, I can't rule it in, but there's no medical guidance at this stage just yet that is a requirement. But again, it's a possibility that we have to plan for.
Right. The ESRI report this week made for interesting reading. The ESRI report into vaccine hesitancy. Now, we know the take-up here. We've had record take-up levels in this country, but there are still many who are hesitant. And according to the report, it's being driven by poor awareness, and I'm quoting now, and a lack of knowledge. What more do you think can be done to give people the information required to give them some form of comfort before going for a vaccine?
Yeah, but first of all, just to take stock where we are at, and there is no doubt, and we speak to a lot of our colleagues across the other European countries and health administrations as well. We are the envy of Europe in terms of the uptake that we have had in Ireland. If you take the age groups over the age of 80 and over, practically 100% take up. 70 and over, 96% take up. 60 years and over, 92% take up. 50 years over, 90% take up. That is the envy of many countries all over the world. So what we do need to do for each age group is to reach out in a very different way, in a very modified way, about the messages. And certainly as we move into the 40s and over, and then as we are in the 40s and over, into 30s and over, it is what we would do is very marketed campaigns, very targeted campaigns to do it. But ultimately it is about the evidence and the benefits. And in simple terms, firstly, you're reducing hospitalizations, and that's mortality, hospitalizations, ICUs, and that's key. Secondly, we're increasing what we call herd immunity. So the more people we get vaccinated, the more you protect the wider public. And then thirdly, it facilitates government to make much bigger decisions and braver decisions about opening society, opening the economy, giving all of us our lives back as we knew it in 2019. And then finally, there is the obvious benefit of what we're seeing at the moment is just a really good factor. People feeling better, people feeling a bit more positive. From a health service perspective, it's giving us a chance to get back to the really important other health challenges that we have and services that we have to supply. And then finally, it is a big issue about mental health. Younger people, older people, people of all ages. We've seen many impacts on people's mental health of COVID, and it is a really personally big issue for myself that, I've seen the impacts of it, I know it, and something that, we need to be always conscious of. So vaccinations work in many ways.
All right. The cyberware attack has caused untold suffering. You talked yesterday about, and I'm quoting you here, the hell that healthcare workers have been through as a result of the attack. How long will it take before things return to normal?
Yeah, and I spent a good bit of time out in the last 10 days in particular in Galway, both our hospitals and our community services in Tullamore and Mullingar, and many other services, and indeed in Carrick and Shannon as well. And what you can see are what people will describe to me, staff in our healthcare system. COVID has been a horrendous 15 months, but the cyber attack just had an explosive effect. And that night of early in the morning of the 14th of May, just an explosive attack in terms of taking all of our systems out and leaving people at high risk in using our services. So what it did do, in very simple terms, we've 2,000 systems all across the health service. All of them exposed, shut down. What we have to do for every one of those 2,000 systems is repair them, restore them and rebuild them. So the impact on our acute hospitals between radiology, labs, diagnostics, just not having the basic functioning services. So where we are now after day 36, just to say to you now, is very steady progress. Our hospitals have a lot of their key systems up between their patient administration systems, laboratories, diagnostic tools. But what they don't have is connectivity between other hospitals, and what they don't have is full connectivity yet between our GPs and our hospitals.
And just on that note, Paul, because again, listening to the press conference, we know the A&Es in hospitals, especially the hospitals outside the cities, are finding it very tough, including the Ceuta group of hospitals. Many of them are in this region. Do you think GPs, and I'm not pointing the finger now, but do you think GPs and primary centres and the general public need to be doing more to help ease that pressure?
No, and I think in fairness to GPs, and GPs have played a phenomenal role throughout COVID. They worked in partnership with ourselves through COVID on many aspects of it, and they deserve huge credit. The difficulty for them at the moment is they don't have access to diagnostics, where they can directly refer people through and stream it through in an efficient way through our hospital system. So a lot of people are coming to our emergency services who may have had an alternative pathway in the future. Now, we will have restored that link, which is a health link, it's called, between ourselves and GPs. It is restored at some level now, but we some further work to do on it. That will help. What we are seeing on the demand and services are a few things. First of all, obviously people haven't come forward for care during COVID, and people are now coming more forward. Secondly, I guess as society opens up, there's more people travelling, there's more people playing sport, there's more injuries, and we're seeing the demands on our services rise significantly. And thirdly then, as people are arriving in our emergency departments, because we don't have the full set of tools restored that we need them, it is slower. So my call to the public here, and your listeners again, Joe, is if you really need urgent care, we are there for you. If you don't, please do seek a GP consultation, consult your pharmacy, because if you do come to our ED, you will be looked after, but it will take a lot longer than we would have liked, and you will like as well. So,
all right. Just before I let you go, the word normal has been used quite a lot over the last 24 hours. How do you see things unfolding over the next 6 months or so? For example, how do you see things unfolding in the area of sport and entertainment and people returning to work?
Yeah, and I think this is where we need to give the public some great confidence and great hope. The one phrase I just don't like is the new normal, because I'm not quite sure what that is. But what we can say to people is, look, vaccination programme is working. The uptake in Ireland here is phenomenal, and it's showing us huge benefits. We will always need to be on our guard with this virus, as I've said earlier on. Anytime we seem to drop it, it catches us again. So I think we have to be conscious about how we meet, how we protect ourselves throughout the next 6 months or so. But people should go into the next 6 months knowing that there is really strong light now. We can all see vaccination programs are working. But in parallel with that, we need to do two things: continue testing and tracing, and that's my call again as people feel they have symptoms. And thirdly, individually, let's protect our guard, let's protect our families, let's protect each other. And I think we will be in a strong society. But ultimately, we will be getting back to the society that we know and love.
All right. Well, we'll leave it at that. I know you have a hectic schedule, so thank you for taking time out to be with us today in our Longford studios, and happy Father's Day on Sunday.
All your listeners, all those dads out there as well.
Thanks indeed, Paul. Paul Reid there, Chief Executive.